Can you just remind everybody your background, just so they're refamiliarize themselves with you?
Yeah. My name is Adam. I'm one of the emergency medicine physicians at our local shop. I've been an attending physician for 7 or 8 years now. Prior to that, 3 years of residency in Indianapolis. Prior to that, med school. And about 22 years ago now, I was a paramedic on the fire department in Florida, and that kind of kicked off this whole journey.
What first drew you to emergency medicine? You know, when you're in med school and you're debating which direction to go, what was it really that kind of triggered in your brain emergency medicine?
I think two things. I was a little older. You know, most people that go into med school, I would say most still probably, are pretty much straight through. So high school out at 17 or 18, college 18 to 22, maybe a year off, med school right after that. I was not that. So since I was kind of a delay fish and went to college at 24, 25, and didn't go to med school till 30, I kind of had plenty of time to think about what fit my personality. I didn't have exposure to all the specialties, of course, but being a medic first gave me a taste of emergency medicine in the field, and I knew that was a specialty, so I figured that's where I would go. And then, you know, all of my shadow shifts and whatnot for hours before med school were in emergency departments because I was a medic and knew people in emergency departments. So everything was geared towards emergency medicine from when I was young. And then I think, honestly, I tried the whole keep an open mind thing they tell you when you start med school. They tell everybody that just in case you find something else you want to fall in love with. It just wasn't my story. I knew through and through. And a lot of that, I think most specialties probably have some component of people tend to be drawn towards them based on their personality to some extent. I think probably emergency medicine is even slightly more that way. You know, as someone who doesn't sit still well, doesn't sleep well, has a million interests, starts 17 things and will eventually finish a few of them, who has a very short attention span, who really enjoys adrenaline rush from hobbies to everything outside of work. Some of us, I think, are just geared towards the specialty of emergency medicine for all those reasons too.
Yeah, I found that because I always wanted to be a doctor when I was in high school, and I remember this program that I had in high school. I can't remember what it was called, but you'd go and shadow nurses in the hospital, and I remember shadowing in the PACU, and I was like, I mean, this is interesting, but man, it's boring, and you kind of do the same thing. I'm like, I don't know if this is for me, and then. You know, I just happened to get my EMT. Didn't even know what it was. And then, man, you ride on that ambulance and you're like, whoa, this is, we just get to show up and try to figure this out from scratch. And
it's its own world.
Yeah, emergency medicine's pretty unique. The pacing and, the variety of things you see. And then the fact that you start from scratch on every patient and got to just figure it out, you know, which is really fun, you know.
It's a specialty for... It's like a specialty for athletic nerds, you know. There's perpetual intellectual stimulation, and there's perpetual activity. It's a physical and a mental challenge all the time, which is great. I think, you know, honestly, if you put me in a clinic for more than 15 minutes, I'd jump.
Yeah.
So that's part of it.
Yeah, I mean, you'd be looking at the clock all day. I feel like our shifts in the ER, you don't really have time to look at the clock, so the shift goes by really quick, and there's something to be said for that, you know, when your shifts go by a lot quicker.
Yep.
Because things are just moving so fast around you, you don't have time to watch the clock.
Yeah. Yeah, it's a plus, I think.
You know, we talk about burnout a ton on the show, and we kind of talk about how everybody gets burned out, right? It's not something you can always avoid. It's something we seek to avoid and minimize and manage. What are symptoms you notice in yourself when you're starting to feel that burnout type of stuff?
This is probably a common answer, I would think. Symptoms that I would say have become more noticeable to me over the years would be irritability early in a shift, you know, before you really deal with irritable personalities or presentations or system failures or whatever, feeling that tension or irritability early because you just have this sense of impending irritation coming. You know, something's about to bother me about this shift. It always does, kind of thing. Noticing that more and earlier into the shift is clearly a sign for me to go, hey, I need to chill out and just take what comes and not be anticipating some obnoxiousness to this shift. And then whatever you want to call it, empathy, compassion, however you want to label what we should strive to have, losing some of that and noticing it, having only compassion and empathy for the really sick or the elderly, and then in between that, not having nearly the amount you should have for the average human who's just being human. Certainly those are signs and symptoms to me that I need to take a deep breath or take some time off or find a better way to cope. It's interesting. I also, I would say for me, I spent some time over the last couple of years where I noticed some of those symptoms becoming more frequent, trying to find ways to handle that. There's still good methodologies to handle that for me, talking to my wife who used to work in medicine as well, taking time off and doing things that are meaningful to me outside of medicine, finding other hobbies to wind down, focusing on sleep patterns, which I never put much energy into. I realize I'm a much kinder human when I actually focus on sleep as much as anything else. I read about for a while all kinds of tips and tricks such as those things plus, mindset techniques. At one point there was a big push towards not focusing on empathy, but changing the empathy part to compassion, meaning you did less putting yourself in another person's shoes and more just having compassion in the moment and therefore being able to let go emotionally sooner after a hard case or whatnot, or an irritating case. I found all those things were helpful, but not, for me personally, sustainable. As depressing as that sounds, it brought me back to the root of, why am I here? Why did I originally why did I originally say, hey, that's a specialty I could do for 20 years? And that really made the biggest change, I think, was letting go of all the techniques and trying to implement new techniques all the time to cope, and just getting back to nothing works for me as well as going back to the start. Why did you feel fresh when you were at the beginning? It wasn't because I had less obnoxious or difficult interactions over time. It was because I knew my purpose. And there's a cheat code to that for some of us. And for me, knowing that without question I was called to be in this position by God changes everything. And it changes and resets my system every time I remember that. That is sustainable. That's a lifelong hope for me. So that's my answer.
No, that's good. I think underestimating the power of this being your purpose, that's super important. I think especially as a PA, where PAs tend to be a little bit more transient. We have the ability to switch specialties. You have a few bad months in a particular specialty and they jump ship, and you see a lot of people that go to a lot of different jobs because we have that flexibility as PAs. But I really keep coming back to the fact that I feel like God has set me in this role. And maybe it's not permanent, but I feel like this part of my life, this is where I'm supposed to be. And that makes the hard shifts a lot easier to deal with when you're this is where I'm supposed to be. Nobody pressured me into this situation. Right. I wasn't forced into this job. I actively sought it out.
Right.
And I feel like it is where God wants me to be. And that makes hard stuff much easier to deal with.
It makes hard people easier to deal with too. Mm-hmm. Let's be honest, in the emergency department, a lot of the burnout that we talk about comes from difficult people. We can all be difficult at times, but we deal with a lot of underlying undiagnosed or undertreated mental health disorders, a lot of personality disorders. We deal with some gruff individuals, which is not something that most people deal with on a day-to-day basis. We will deal with those people being aggressive with us or frustrated or irrational daily, no doubt. You walk into a shift, you're going to have at least one interaction like that, period, because we meet so many people. That's just how it's going to be. And knowing that I was put in this moment in this person's life, it makes it more of an opportunity and a gift, which sustains me, than it does just something to get through. Looking at people as human beings. They may or may not have the same coping skills as some of the rest of us. They may not handle or interpret things the same way the majority of the population would. So it's my opportunity to try and reach them in a positive way when others may never do that daily in their life, which just perpetuates their cycle of living in their mindset. So I have a chance to be some little cog in that wheel, which is probably good for both of us.
Yeah. And I think that helps you, that perspective helps you avoid the cynicism that I think really burns people out, makes nurses leave the ER to go to other places. Yeah. Like, you really have to avoid becoming cynical, which is so easy. Because like you said, I mean, the mental health, I mean, worldwide since the COVID pandemic, I feel like has really taken a dive. And we all know that, you know, if your mental health is not doing well, that's going to manifest as physical symptoms. And a lot of our job is proving that these physical symptoms are not an impending emergency or an active emergency, and reassuring people. I mean, that's a lot of what we do.
It is.
One thing that's helped me recently is, well, getting rid of social media completely and not scrolling social media, because I went down this rabbit hole where I was seeing patients who had gone to the ER just railing on the physician that saw them, and I can't believe they didn't make this super rare diagnosis that's taken me 20 years to get. And of course you like get indignant. You're like, I could argue why the ER is not the place to get this diagnosis. I can tell you exactly why they did what they did. And you get really indignant. And that was just making my mental health go horrible. Worse. And then I would go in and work a shift, and I would assume every patient has like this bad intention, and every patient hates the ER. They, you know, they're going to be unhappy regardless of the outcome. And that's not true the majority of the time. Like, every patient is not that person posting on social media that hates the ER and is very unhappy. And so what's helped me is like totally reframing and assuming good intent on every other human's part. You know, even the staff I work with, if you assume their intentions are good and then humanity in general is good. And that shift where I kind of made that switch was super fulfilling. I went into every patient room assuming that this patient is a good human. And that they understand kind of how the ER works. But like, my affect with them was just so much better than...
Certainly.
It's so easy to become cynical in this line of work. We all work a ton of hours. You see patients from every walk of life. And if you assume every patient is that one patient that really hates the ER and doesn't understand what we can do and is very unsatisfied with the care, like, you really can become cynical. And it can happen quickly. But,
you know, the other thing along those lines, the other thing I used to say to myself and to others, I think you had a guest. Lucas was on here a couple of weeks ago. I think he said a similar thing about, you know, every time you get that one kind of life-altering or even life-saving moment, you know, you did something that really altered that patient's care. You saved a life, or you found this diagnosis, or, you know, you stabilized this sick patient, their family was grateful. You hold on to that one moment, whether it's every shift, every month, every year, whatever. Whether you have a long period of time where things were not that way and then you were an emergency physician for the day, you hold on to that interaction. I used to say that, and I believe it. I believe it. I do, and I still say it. Don't get me wrong. But I also have found it helps me a lot to hold on to what feels rare some days and avoids cynicism, holding on to the moments where someone's just thankful. You know, if I have 2 patients out of 30 that day that literally took an extra 10 seconds to go, I just want to tell you, this is the best ER I've never been through so fast. You know, your nurses were so nice today. You, in particular, were so patient and kind. And, man, you just explained that in a way that I really understood. I'm grabbing onto those. And I'm going, man, there's people out there I can actually reach, and I didn't do anything to save their life. I may not have made any diagnosis. I may have just reassured them. But they were so thankful for the care today, or the way that I chose to interact with them, or for making them laugh. That's common. Then I treat that like the life saved, you know, because that one will offset, you know, one life saved will offset 10 bad outcomes that you know you did everything you could do. But it's hard emotionally. That will offset the next 10 interactions of people who were irritable, frustrated, couldn't be satisfied at the end. And I'm like, well, one of those people was super grateful. I'm doing something right. That helps.
And when you look for those, you tend to find them a lot more.
Because
Lucas and I talked about this, how your brain fixates on the negative. You know, like it's so easy to remember negative interactions, things that don't go well. But you kind of graze over these positive interactions, and there's actually a lot of them throughout the day if you actually remember to like put that in your long-term memory, because a lot of our patients are very grateful, and a lot of them are very happy with just being reassured they're not having a heart attack today.
It's true.
I mean, how many people do we see that's their fear? They're having a symptom that could be a heart attack. We prove objectively you're not having a heart attack. And they're so reassured by that. That's what they were worried about. That's what we proved is not going on, and they're very happy with the care.
Yep. There's more of it than we give credit for.
Mm-hmm. Yeah, and it's just so easy to focus on the negative.
Yeah, there's plenty more opportunities, but you don't have to make it the majority of your job.
Do you think there's anything? I mean, as clinicians in the ER, we try to set the tone, I feel like, for the rest of the staff, especially in smaller facilities. It's even more important where they're watching you all day. They're seeing how you interact with the patient that staff feels they don't need to be here, or I can't believe they came here instead of a bigger facility. Like, are there ways that you try to set the tone in a shift to try to be a good example to the rest of the staff?
I do two things. One of these could be right or wrong. One of them I find is personally helpful, but again, this is personality dependent. The first one for me, not purely cynically either, but to maintain a good level of humor helps. Now, again, some of that's personality dependent. I tend to be pretty high energy and boisterous, and a lot of ER personalities find that comical, and some personalities outside of the ER do not find that so funny. That's okay. Speaking about on the job, though, I think having a light heart and being not, again, necessarily cynical, but humorous about a lot of the job and the downfalls, or making light of not the person's plight, but in general, how we got from point A to point B in that person's mind, where they had some simple symptom and then came in here thinking they're dying, and you're like, I'm not even sure how you got there. Making lighter of the situation. I'll do it with patients too, to get them into a place of reassurance if it's truly something I know I'm not missing anything, because that's the flip side to that, obviously. So I think having a good sense of humor without going into the negative helps a lot of the staff. And I have seen that innumerable times over the years. If I come in a mood and I'm not playing around anymore, I'm burnt out, this has been a rough run, and I wear that on my sleeve, everyone's coming along for that ride. Let's be honest, and I think they'd agree with it. You get a gaggle of ER nurses together, and you bring that mentation, you're digging a ditch, and you're all going to get down in it together.
Yeah.
As the leader of that, whether you say that's what it is or not, you are, as the provider, you set that tone above and beyond that, they'll tend to follow it throughout a shift, and that's a good thing, and that's a perpetual cycle for all of us with each other. That said, you do have to be careful about not missing things in the ER. You take everything lightly, you start getting into a mood of, good Lord, nothing that checks in today is going to be even close to the word emergency. You might miss something there. I mean, this job is out to get you. You can't get to the point where that's the case, where you're just, clicking the discharge button because you're irritated and you didn't work things up, or at least intellectually challenge yourself to put together an emergent differential. That's where this job will get you. But if you're not playing that game, I think you're in a good place to kind of make light of it and keep moving kind of quick. The other thing that helps, now again, this is practitioner based, and I'm on, admittedly, the far end of a spectrum of ER docs where I'm a bit of a minimalist, and so I discharge a lot of people and fast. And so I spend my time, for safety's sake, listening to other people's input around me. If they feel uncomfortable, like a PA with me goes, well, what about? I should stop and think about it and not ignore that comment, number one. Number two, thinking about a differential and spending my time on return precautions. I probably have more bounce backs than the average individual because they did what I told them to do. That's okay with me, personally. So the other thing I would say helps with that environment is fast discharges. Nothing brings the mood up to a bunch of ER techs and nurses and other providers in the hospital when your discharge time is half of the provider before or after you, when you feel like it's appropriate to do such. So I keep my butt moving for 8, 9, 10, 11 hours, whatever the shift is. And people get discharged that need to be discharged quickly. They don't sit there for an extra 30 minutes while I get distracted by other things. Discharges happen fast when I know that it's safe, and that keeps the mood up. You start slowing down, getting into the curve of things and being like, yeah, that silliness didn't need to be here, but they could have left 15 minutes ago and opened up that room. Nurses don't appreciate that either, and the attitude goes down all around.
Right. Well, even like a extremely thorough workup, you're scanning their whole body, you're checking every lab you can possibly think of. even that being negative doesn't mean something's not going on. So, I mean, the return precautions are huge. Medicine, that's kind of the line I give patients. Like, medicine is not 100% perfect. I'm not 100% perfect. Right. If you're worried things are getting worse, things are not getting better, come back in. And most of the time, whatever it is resolves on its own. It's something self-limiting because their workup was reassuring. But, you know, you have those rare patients where things aren't getting better and they have to come back in to get a diagnosis.
That's right.
You know, even like appendicitis, if that gets missed on the CT scan, we're probably not going to diagnose it. Right. And if they're not getting better or worse, maybe it shows up on a subsequent CT scan. Nothing's 100% perfect. What are your thoughts on Tylenol and pregnancy? Just kidding. We're not talking about
You want to go on some political
We're not talking
soapboxes
about
today,
that.
huh? Don't get my snicker as an answer, by the way. Don't take my smirk as a definitive answer. Yeah. I won't answer it unless you want to do another 3-hour podcast.
I'll probably erase that question from the podcast completely.
I think you should leave that sucker in there, but that's just me.
One thing we don't talk about every show, and something that we've talked about in the past, I'm a Christian, you're a Christian. Yeah. I don't talk about that every episode.
Maybe you should.
But yeah, I mean, sometimes I like to delve into it a little bit.
Yeah.
You know, not everybody I have on the show, most of the people I have on the show are not Christian or don't think about faith a whole lot, but I think it's an interesting topic to discuss when you do have some faith and you believe in God. How does that affect your ability to handle like the emotional stuff we deal with, the hard cases, the death? I mean, how does that square with your faith?
Yeah, it has everything to do with it. It has everything to do with it. It has everything to do with the reason I'll go back to work tomorrow or the next day. I'd have to look. It has everything to do with everything that I do in life and on the job. I don't know. I do not mean to insult anyone by this, and I do understand that there's a lot of differing opinions out there. Don't get me wrong. I'm just one of them. I would have chosen an easier job with a shorter route to get to it if it wasn't for God. I would have slept less, stressed more, and I don't know how ultimately I would have coped with some of the things that I've seen in the emergency department without the hope in the future that God promised me. And not selfishly that God promised me, that God promised man, humans, men and women, all of us, for those who seek Him. The hope that I have in the truth of Jesus, which is where I'm coming from, sustains me. And that simple, age-old, and to me, I don't mean this insultingly, I just mean I don't think people have thought any deeper than asking this question. The question of why then do all these awful things happen to good people? I mean, in my opinion, again, that's a 3-hour plus podcast, but I will say this. I think that's a off-kilter coping mechanism for the people that ask that question. I think it's a crutch. I think if you weren't looking for an argument, but were looking for a conversation, I could have it with anybody, and I'd be happy to. And I may not have all the answers that they want to hear, but I'd be happy to have that conversation. Because the things that people are given the free will to do, which leads to the world we see, it only shows, at most, that we, individually, are not God. And He calls us to His standard, and I'm willing to strive for that, but I won't reach it. The potential to do harm, to do evil, to seek only what we want at the ailment of others is high without a moral compass over the top of us. And so when I see the awful things that we see in the emergency department, I don't ask, why did this happen to that person? The Bible also discusses an old Hebrew term known as hevel throughout the book of Ecclesiastes, which is not well understood, and I am no scholar on that book, but it discusses why these things happen in life. Why we'll never have an answer as to why some of these happen in life. But where to go with that hurt and that debate, and it's back to God's feet, and I'm okay with that. I mean, there are a million reasons why I find this job not only tolerable, but a gift, thanks to my hope in God. That's a long conversation outside of that little bit.
Yeah.
Yeah. I think, I mean, you asked, I guess I'm just going to go out there with it. I don't understand their hope. You know, what, 80 years or something on this planet trying to do good by others. Great. I mean, that's excellent. But again, the potential for harm when you don't have a future hope beyond that, or a moral compass, or a standard, which is what it is to not have a God, you're on your own. And what we're capable of as people, I'm not willing to find out who I'd be without him.
Mm-hmm.
I have no desire. I wouldn't trust myself. So,
for me, it helps as a frame when I go into work that we're supposed to be Jesus' hands and feet to the world. And then I think, like, we're supposed to be that light in the darkness. We see a ton of darkness in the ER. You see a lot of cases where there's no good answer to why do bad things happen to good people. I think part of it's we live in a fallen world. I mean, the sun's trying to kill us every time we go outside. I mean, gravity's trying to kill us. Right. I mean, there's certain things that I think that God does not control. Yeah, and I think that some of his limits that he's set on himself to allow free will, mm-hmm. even at the cellular level, mm-hmm. there's free will. DNA doesn't form. I bring up this example before, but, you know, my wife and I had a miscarriage. God has put limits on himself to allow free will, and that happens even at the microscopic level when DNA is being formed and it doesn't form correctly. And I think something like a miscarriage hurts God as much as it hurts us. That's not his ideal plan for the world, but we're living in a fallen world. And I think that as a result of that, we're called to be his hands and feet to the world, and we're supposed to bring light into a lot of very dark scenarios. And that kind of provides me some reassurance that that's my role, and that's kind of how I frame it is, you know, I'm going to walk into a very difficult shift, and I'm going to be that light as much as I can, you know. And of course, none of us are perfect. None of us are ever going to be Jesus, but we're striving to hit a higher standard as a result. And I think that helps our patients, and it helps the people we work with. As Christians, we don't have an answer for everything. I don't think you can, but that's just kind of my brief thoughts on it.
Yeah, I think, you know, to berate not men's actions, right? We're not going back to a conversation about the Crusades. Just the idea of Christianity to berate someone for bringing what they believe is hope and a future into a room, into an interaction, it is illogical. The idea of a Christian who believes he wants to be more like Jesus should only bring patience and kindness and hope into an interaction with another human who's suffering, and nothing less. That's the ideology. We don't all do it very well all the time, but the goal is to strive to get there.
Yeah, and we talk about standards, and I think that, you know, none of us meet perfect standards. We all start the day maybe with lofty ideas of what we want to accomplish in that day, but I think just shooting for higher standards than you naturally want is going to get you in a better place than having no standards or low standards. You know, and we're working from the perfect standard, Jesus, and we know we're not going to hit that mark. But aiming for it, I think, means something.
It does. It should.